I'll be talking about pulse dye laser. I have no relevant disclosures. So there's a variety of devices that can be used to treat vascular skin lesions, including the pulse dye laser, which I'll focus this talk on and talk about, all the different things about why I love pulse dye laser. Other vascular lasers include KTP, alexandrite, and Nd:YAG. There's also some newer generation devices that combine wavelengths as well. These vascular lasers target hemoglobin, and here's a graph of the absorption spectrum as a function of wavelength. You can see that pulse dye laser has a nice peak of absorption for both oxy and deoxyhemoglobin. KTP does as well, but at a shorter wavelength, you can see that the absorption curve for melanin in blue, melanin has a greater absorption for KTP laser, thus this limits treatment in darker skin types. The pulse dye laser with less melanin absorption is safer for a wider variety of skin types, which is really important for my practice in Houston, where we see a very diverse patient population. Looking at the Nd:YAG laser for treatment of vascular lesions, there is a lower absorption coefficient of hemoglobin as compared to the pulse dye laser. Additionally, in terms of depth of penetration, shorter wavelengths like the 532 nanometer KTP limits depth of penetration, making it deeper to reach larger and deeper vessels. The 595 nanometer pulse dye laser at a longer wavelength penetrates deeper into the skin to reach the targeted blood vessels. Longer wavelengths like the 1064 nanometer Nd:YAG can go much deeper than the 595 pulse dye laser, which is good for certain indications, but is often not appropriate for many vascular diagnoses. You can kind of think of pulse dye laser as the story of Goldilocks and the Three Bears. Not too much, not too little, but just right. Here are just some of the indications amenable to pulse dye laser therapy, including erythema, telangiectasias, rosacea, photoaging with poikiloderma ovale, vascular birthmarks, including capillary vascular malformations and infantile hemangiomas, cherry and spider angiomas, angiokeratomas, post-procedural purpura, erythematous scars, striae, the vascular component of melasma, acne with PIE, and much more. And as mentioned before, pulse dye laser can be used for a wide range of skin types, provided that settings are appropriately adjusted. Some strategies to utilize for skin of color include using a larger spot size, increasing the pulse duration length, lowering fluence, and of course, definitely ensuring that there's adequate skin cooling. Here's an example of pulse dye laser being used for perinasal telangiectasias with a really nice improvement 4 weeks after one treatment. Here's an example of improving severe erythematotelangiectatic rosacea. This was 4 weeks after 3 treatments. This patient of mine had a nice improvement in the keratosis pilaris rubra of her cheeks after just 1 treatment. Here's an example of the pulse dye laser being used for a capillary vascular malformation in this Fitzpatrick skin type 5 patient. You can see a nice improvement here after 3 treatments. Definitely for this patient, I was using larger spot sizes, trying to get deeper depth of penetration with the laser to bypass the epidermal melanin layer. Here's another example of a capillary vascular malformation in this Fitzpatrick skin type 4 patient of Middle Eastern descent. This was 3 months after 3 treatments. So the before is obviously on the left, the after is on the right, but you can also see that we're not able to treat through hair with this laser, so even in the after picture, you can compare untreated areas to the treated areas. This patient of mine had a history of being treated with an argon laser when she was much younger, and that resulted in some hypopigmented scarring that you can see. We used the pulse dye laser to treat her capillary vascular malformation. You can see a really nice improvement here after 4 treatments, much less painful compared to that older technology. The healing was much easier compared to that older technology, and then you can see that nice improvement without contributing to any hypopigmentation or scarring. The pulse dye laser can also be used to safely treat port wine birthmarks in all ages. Early intervention is important for capillary vascular malformations and actually allows for better results for several reasons, including that the skin is thinner, there's less competing melanin, and kids are able to be swaddled without needing anesthesia. Here's an example of using the pulse dye laser for infantile hemangiomas. This cutie's infantile hemangioma started around week 4 of life, and we started pulse dye laser treatments on him around 2 months of age, when the hemangiomas were just starting to become slightly raised. You can see a nice improvement here after 2 treatments and complete resolution after 5 treatments. Topical timolol was also used at home, which was started by an outside dermatologist before they came to me, and then the the laser worked so well that mom decided to stop the treatment, stop timolol after the second pulse dye laser treatment, and he's done very well and stayed clear. For these patients, I'm using lower pulse durations and low affluences. So for him, I did a 12 millimeter spot size, fluence of 5, and pulse duration of 1.5 milliseconds. And we treated him about every 3 weeks or so at the beginning. The pulse dye laser is also great to treat multiple vascular lesions in the same session. You can see a nice improvement here in his angiomas, with the smaller ones resolving after one treatment. The larger ones can require more than one treatment for most optimal results, but you can see that they are smaller. There's also a nice improvement in his perinasal telangiectasias and then just general overall redness in his skin. Here's another example of using a pulse dye laser for angiomas. Again, larger angiomas can require multiple treatments for most optimal results. But this patient's of Hispanic descent, and she did very well with the pulse dye laser. The pulse dye laser also does great for spider angiomas. These are all examples of patients in the past year who gave me consent to use their photos for lectures, but then they never came back to the office for their follow-up photo because the spider angioma was gone after the first treatment. I do try to make sure I have that endpoint of purpura for the entire spider angioma, including all radial telangiectasias, whether that being using a spot size to adequately cover the entire thing, or if there's still some radial telangiectasias outside of that, I'll switch to like a smaller spot size and make sure I target those. Pulse dye laser can also be used for ecchymoses to get them to resolve quicker, which can reduce the risk of hemosiderin deposition. It's best to treat bruises early and while they're still purple, usually within 48 to 72 hours. Here's an example of using pulse dye laser for erythematous scars. This patient of mine was in a motor vehicle accident where an 18-wheeler actually hit her. You can see a nice improvement in scarring after 4 pulse dye laser treatments alone, and then once the scars were more stabilized, we added in ablative fractional resurfacing as well. Here's a patient of mine who had a nice improvement in this scar after falling off a ladder. I combined pulse dye laser with intralesional Kenalog and 5-fluorouracil. Here's another example of a nice improvement combining the PDL with intralesional scar treatment as well. This was 6 months after just 2 treatments for these dog bite scars on the bridge of the nose and then left upper cutaneous lip and cheek. And finally, here's an example of a surgical scar. This patient had a cyst on his chin that was excised elsewhere and came to me for help with this residual scar. He was very happy with the results after 3 treatments. So thank you to Dr. Sean Wu for inviting me to be part of this talk, and Dr. Nkem Ngunabo for collaborating with me on this session. And also thank you to Dr. Paul Friedman for allowing me to use a few of his before and afters in this talk as well. Thank you.